嗨，大家好，我是 Dr. Alan， 欢迎回到我的频道。上个星期我们讲到角膜塑形镜片，它是如何控制近视。假如说你还没有看过这个影片的话，我会把链接放在下面，等一下你可以点去看一下。那今天呢，我们请到 Dr. Sophie 跟我们分享到说，散瞳剂是如何被用来控制近视，它的优点跟缺点，它的副作用有哪些？那我们就一起来看一下今天的访谈内容。
Okay, so now we know all about orthokeratology and how it can be used as a treatment strategy for myopia control, right? So what about for parents that do not want their kids to be on ortho-K? Do you have any other alternative for myopia control?
Yeah, just yesterday, I actually saw the kid for a consultation, and unfortunately, the kid had a cornea scar on his left eye due to being scratched by a paper when he was younger, and that led to an infection, and that led to a cornea scar. Kids with cornea scar, we definitely do not recommend ortho-K wear. So for him, we recommend atropine instead. So atropine is a medication eye drop that dilates the pupil and relaxes the ciliary eye muscle. Ciliary eye muscles normally help the eye focus, so a common side effect of atropine eye drop is blurry vision while reading. Many years ago, we knew 1% atropine helps slow down myopia progression, but it also made a kid's vision really blurry, especially up close, so it was not commonly prescribed. But just the past few years, there's been multiple studies that have shown that lower concentrations of atropine can actually help slow down myopia progression, and the side effects are minimal. So because the side effects are more minimal than the original 1% that was studied, a lot of doctors felt more comfortable prescribing the lower concentration atropines. And it's become more a popular method for myopia control ever since those studies came out. With the atropine eye drop, it dilates the pupil, so they do become more light sensitive. So it's important for them to have tinted glasses when they're outdoors. But kids, there's no way they can switch to sunglasses and clear pair multiple times throughout the day. They will just lose their glasses. So we just have them do photochromatic lenses that will automatically do the switching for them.
That's great. Yeah.
As of today, we do not know exactly the mechanism how these eye drops slow down myopia progression. But based on the studies, the lower concentration dosages do slow down eyeball growth length. But the mechanism how it slows it down, we don't know yet.
So for these atropine eye drops, I know there are different concentrations available that you guys can prescribe, right? So how do you pick and choose what concentration to use for kids?
So the three most common low-dose atropine concentrations that has been studied are the 0.01%, 0.025%, and 0.05%. So most doctors will go for one of those three concentrations because they've been studying the most. But recently, newer studies have shown that a 0.01% has minimal effect on slowing down the speed of eyeball growth length. Interestingly, it does statistically slow down the prescription a little bit, but not the axial length, so not the growth of the eyeball length. So because it doesn't slow down how fast the eyeball grows, most doctors do not use the 0.01% as the sole treatment for myopia control anymore. So 0.01%, we don't use it as a sole treatment. The next two concentrations are the 0.025 and 0.05%. Between the two, the 0.05% does give better control than the 0.025%. In terms of the side effects, 0.05 just has a little bit more side effect compared to the 0.025. But since it has better control and with only a little bit more side effects, most doctors now choose the 0.05% as a first line treatment for myopia control.
谢谢你愿意看今天的内容。下个星期我们会继续请 Dr. Sophie 跟我们分享到说，小朋友日常生活中有哪些东西需要注意，有哪些习惯是必须养成，以避免他们太早近视。假如说你想要知道的话，你现在可以点击荧幕去看我们下次影片哦。那我们下次影片再见，拜拜。